Hello, ladies and gentlemen. Thank you very much for joining me today in this live webinar. Looks like we have a wonderful attendance here. I'm just so happy there's so much more enthusiasm about improving your health. That's wonderful. And I'm glad to see people are staying home and working on, their health, or interested in improving their health. So today's webinar is about improving respiratory conditions naturally, based on basic Ayurvedic principles. We're not treating these health conditions based on their medical label, but on their symptoms. So first, we're going to go through and describe the different categories of respiratory conditions, based on Ayurvedic principles without using the terminology. And then second, we'll go through and talk about what we can do in our diet and our lifestyle to help address these. And then third, we'll talk about different herbs we can take to resolve it. And I have some supplements here too that are not herbal products that I make, but supplements that are available in the market that you could purchase that could help you with improving your respiratory condition. So if you have any particular respiratory issues that you like to address or questions, please feel free to text me or message me during the webinar in the public group room. So first, let's look at our respiratory health. That's what we're talking about. Last week, we talked about our immune health and our ability to resist pathogens and how to strengthen our immune system. So this time we're looking at our respiratory health, our prana, vayu, sutra, our breathing air system that's providing us with our air, life energy, oxygen, and of course expelling carbon monoxide and toxins every 24/7. So it's obviously a very important system. And we're going to be covering in an indirect way, asthma, bronchitis, respiratory allergies. But I want you to look at your respiratory system in this manner, first of all. First, is it dry? Do you have dry respiratory system? Difficulty breathing, and you need something to drink and you feel it's dry, and things like butter or oil or just sipping licorice tea feels better. That's one category of dry type of respiratory condition. You have difficulty breathing. We know our bronchi aren't dilating sufficiently, but we just see the symptoms as difficult, dry breath. Second is, and that of course is Vata. This is in Ayurveda, this is a Vata type of imbalance, and where it's dry and light and rough. And we'll talk about how to avoid that or treat that in a minute. And the next category we could see is congestive respiratory condition. This is it's more productive, we could say. There's more mucus, phlegm, you're clogged, spitting out phlegm. In the morning, you got big phlegm balls coming out. In the day, you're in both cases, you could be coughing. You could have the dry cough. Was it like a smoker's cough? And you could have the clogged kind of mucusy cough where you're spitting and there's mucus and phlegm coming out. So those are the two main categories. You should know which category you're in those two. Whether you have a cough or not is kind of a secondary symptom. But first, we got to know, is it dry or is it congested? Because all the remedies and treatments, whether they're herbal or even dietary, all will depend on these two qualities. The next two criteria you want to look at when diagnosing and understanding your respiratory health is it inflamed or not? Is it painful? Is there infection? Now, when we have a dry cough, it's coming out, dry and phlegmy, and our mouth is even dry and sticky. When we have a wet or mucus, productive type of cough or respiratory condition is white phlegm, white on our tongue, white phlegm balls. But when we have an inflamed respiratory condition, bronchitis, for example, or pneumonia or flu, then we're going to have mucus that's going to be more yellow in nature and showing the infection. So that's the second criteria. Is it infected and inflamed or not? Is it just congested? For example, if you live in a polluted city where it's a lot of dry. You may just have a dry cough, or maybe you had spent time with you got a lot of secondhand smoke in your life, so you could have the just dry cough. But it may not be infected. Of course, its probability of being infected is much greater when you have this dryness. Just like in the mountains here in Ojai, a couple of years ago, we had fires. And the fires were the result of the dryness. So when there wasn't dryness, there wasn't the fire. So when you have excessive dryness in any system, organ, or tissue in your body, you're very susceptible to inflammation. Just like, because every system and organ in our body needs moisture. So, this type of person who's dry is going to have dry skin, dry tongue, maybe dry stools. And this dry cough is just going to be what they're focused on. But in fact, the whole body, more than likely, is dehydrated and dry, even though they could be drinking a lot of water. So this type of person definitely has to hydrate and drink more water, hot water, sipping water, cold water. I mean, hot water all day long, no cold water, and hot foods, and more oil and more fat and more butter. See, because there's a dryness, and particularly ghee and butter. It's very soothing and, starts to coat the esophagus and provide some relief. And many people are drinking water too fast, and then they just urinate it out. Well, and then their skin is still dry. Their lips are still cracking, and they still got this dry cough. Well, that's because they're not hydrating the bodies. But when you drink a hot tea, very hot words, you're just sipping it. It's that hot. Then, and you sip it slowly. Then you don't urinate it out. So you sip slowly throughout the day. Hot tea. And we can talk about different teas for the respiratory system that you could use. But the main concept is you have to hydrate the body first when you have this dry cough, a dry respiratory difficulty in breathing. And then it's similar but different when you have the mucus and congestion. Then when you have this mucus and congestion, you have to stop everything that's creating mucus and congestion. And the worst thing for creating mucus is yogurt and almost all dairy products for that. Cold milk, cold drinks, cold foods, will aggravate this mucus. So again, you're back to hot foods, hot soups, hot drinks. Whether you have mucus or dry, you should always be having hot liquids, hot foods, no cold foods, no salads, no cold salads, no cold leftovers out of the fridge, no cold drinks out of the fridge. No, this will only exacerbate, particularly the respiratory condition that has congestion. You want hot liquids, warm and clearing. If you have this mucus and congestion, no eggs, no cheese, no milk, no yogurt at all, particularly at night. It's only going to make it worse. And you want to have things that are clearing and cleaning, so to speak, of the respiratory system. Onions, garlic, hot spices, black pepper, chili pepper. This will get the break up and clear the mucus out of the bronchi and the alveoli and help dispel it and out of the system, because that's what the body's doing when it's coughing. It's trying to, clear out these contaminants in the lungs that have built up. In this case, the excess mucus. So when you have this mucus, then you don't want to have too much like cucumbers. Even this is cold and liquid, and salt. You don't want to have too much salt as well. If you have this mucus, you don't want to be retaining more water, which is what sodium will do, is help the body retain. But if you have dry cough, then you want to have more salt water and help to restore your state of hydration. Now we're going to get to the herbal remedies, and the herbal remedies are also based on this dry mucus criteria. And then on top of that, you can have infection. Just like I said, if you have a dry cough and dry respiratory system, you're going to create an environment for infection. Just like, say, your heels get so dry that eventually they crack and they become infected. Or the mountains, they become so dry, they become inflamed. So first there's dry and a little painful and itchy, and then it becomes susceptible to infection because it doesn't have the mucosa, which is like a protective coating in our tissue that's exposed in our throat, our esophagus, and even inside of the lungs itself. We need mucosa protecting our lungs. So when it's dry, we lack this protection. And if there's too much mucus or phlegm or congestion from poor digestion, having too much cold food, having too much dairy, and you've got blocked nasal passages and mucus and congestion, well, you're making, a place for any pathogen, whether it's bacterial or a virus, to stay and make a home and to reproduce itself. So we don't want to have too much congestion, or we're not allowing the natural eliminating processes of the respiratory system to expel out any of these pathogens. So both are very important to find this balance. It doesn't matter what you call the respiratory condition. The main is you don't want to be dry and you don't want to be mucus. You want to have both noses clear, both working good, not clogging up. Signs of congestion are snoring, waking up at night, difficulty breathing. This is all congestive breathing problem. Of course, in Ayurveda, we call this kapha, and we have to follow a kapha pacifying diet, which is not much animal protein, a lot of hot spices. Now, remember, this is the next criteria on top. If it's infected, generally, if it's infected, you have to take some herbal remedies to get rid of this infection. But again, you could be taking a garlic, onions, and other types of antimicrobial spices, bay leaf, cinnamon, licorice, would help in breaking up this congestion. But that's why in the old days we just had that hot chicken soup, which was hot and clearing and nurturing and had some spices in it. And this would help us to clear this congestion and overcome infection. But once you have infection, then herbal remedies tend to be the quickest at that point. And now the fourth category is if you have a seasonal allergy. This means that all year long you're fine until you're exposed to some pollen or some dust that aggravates you. So you could be fine in the house, but then when you go outside and you're exposed to the grass, then you have the reaction. So this is an allergic type of respiratory condition. And then you have to use more antihistamine type of herbal products to kind of manage the immune system so it doesn't overreact. There are a few dietary guidelines in this case, but mostly we're using herbal remedies to manage and modulate the immune system. And there's many herbs that are known to have this type of antihistamine effect, which can be taken. Now, these herbs that are, we're going to cover these that are used as natural antihistamines, they would then be combined with herbs that were either for a dry, non-productive cough or with a productive cough. So, but in most cases, we want to stop all dairy. Unless it's dry, you could have some butter or ghee. That would be it. But no cheese, no yogurt, and in all cases, no cold foods, no cold drinks when you have any type of respiratory difficulty. Now, unfortunately, the herbs work quite good. Let's talk about a few different herbs. L-champagne, I don't know if people are familiar with this, but L-champagne is a herb used both in Western medicine and in Ayurvedic medicine. They call it Pushkar Mul, and it's an expectorant and decongestant, and it's used when you have blockages. And congestion is very heating, very hot. It's kind of it's helpful for coughing, bronchitis, asthma. And here we go. We can see it's the first ingredient in lung tea, L-champagne. And next we have coltsfoot and comfrey, marshmallow root or slippery elm. And marshmallow root or slippery elm are providing this is a demulcent, providing like a coating, like licorice, to the inner lining of your respiratory system and soothing it. And there's a little black pepper or pipili. So that's the expectorant and decongestion. And coltsfoot is used to reduce coughing. And there's Mullen, which is known to help the entire respiratory system. But in fact, this tea, since I make it, is half L-champagne, because L-champagne is the the one that's the decongestant, that's breaking up the phlegm, making you spit out the phlegm. And we use it both in Indian herbalism and Western herbalism. Here's colt's foot here. You can see it's a little, not much left in the bag there. We're making a lot of teas. It's got a very nice tea. It's in most of these formulas. And we usually, if a person has a lot of cough, we use more. There's Mullen. Look at Mullen. Mullen is a flower. And we also use this for people who've had smoking coughs. And also lobelia, which is another herb that's well known for helping with respiratory conditions. And we give lobelia to people who are trying to stop smoking cigarettes. And then we mix it with the Mullen to help the respiratory system. And then lobelia smoked is very good for the respiratory system. In fact, some of these herbs can be smoked and inhaled, not in the case where you have the dry cough, but when you have an infection, then you can actually burn some Mullen and sage and inhale it. Well, the sage will fight the infection. Well, the Mullen will help the respiratory system. So there's many herbs that are used even for smoking for some types of respiratory conditions, particularly when you're involving an infection. So here's some products that I think are really worth noting here. Oba. I'd like to meet Oba. She's got a great product line. I don't know if she really existed, but I just imagine a Swiss herbalist. And I think it was by a doctor. And this is a wonderful product for coughing. And we can look at the ingredients here. We can see right off the bat, we got a lot of common herbs here that they're using: thyme extract, licorice, and pine, peppermint, eucalyptus, juniper, winterberry, and clove. So, and in honey. So there you go. A wonderful, simple formula, which you could probably make at home with essential oils and honey. And honey is an expectorant and a decongestant too. So this tea, like this lung tea that I mentioned here with the colt's foot and the L champagne and the slippery elm and the black pepper and the licorice and a little ginger, will be very nice in honey because it's also an expectorant and decongestant. And here's some chest rubs. You can get many different types. I just, pick these because I like the herbal formula and they worked before in the past. But this is, again, eucalyptus. We didn't bring eucalyptus essential oil up here, but I should have had it up on the table. But it's got eucalyptus and pine in it. And this is rubbed on the chest. And this starts breaking up mucus and congestion quite quickly. So this is, you can buy one of these products and they work very well. And also we have some different types of what's called nasa, nose oils. And they are using herbs like tagar and Vata and even some Brahmi oil that clear the nasal passages. And you just put a couple drops in each nose. You should be lying down. And this it helps really clear out the respiratory system. Right away, you can start to have a little runny nose, and it clears it right out. And then it lines and lubricates the inside of the nasal passages that keeps it clear and helps you to continue breathing. For example, a child, even a young child, 1 or 2 years old with some breathing problems, just this type of nasa oil that's for respiratory purposes is put in the nostrils. It can be enough to help the child breathe clearly. Somebody asked me a question, what type is it? Well, there's many different types of nasas. In fact, the one I did wasn't for respiratory. This was for brain and memory, but they look the same and they're little bottles, and you can buy them online in any Ayurvedic shop. So let's look at some more traditional herbs here. We went through some Indian herbs, and we didn't cover here. Now, if there's an infection, like I said, then you want to take an antiviral, antimicrobial formula as well. And there we could put this on top. There's the Mullen again. This is for cough, soothing that cough. Mullen, colt's foot, and slippery elm. Very and licorice. Very effective, very soothing. Mullen is that flower that feels very soothing. Colt's foot is known to help reduce coughing, and slippery elm and licorice are the demulcents that just make it feel good. So that's a cough tea. And then, we had if you had infection, that's what I wanted to get at. That was just for coughing. I grabbed the wrong one. Here it is. Cold and flu tea. It's not bagged up. See, fights viral and bacterial infections while supporting the immune system. So you can't see the ingredients there, but we've got Oregon grape in there, a little sage, cinnamon, licorice, thyme. Yeah, and that's Oregon grape. That's the antimicrobial, antiviral. So if you had an infection, you'd want to be going for the cold and flu tea and getting those antivirals in there to help fight off this infection. And then you could combine it with one of the other products that's for mucus or congestion. Yeah, of course, somebody's asking me about these teas. Yeah, I'm making these teas and selling these teas. I'm just trying to educate you to, maybe some of these ingredients you can find on your own. But if you do have a serious respiratory condition, it's obviously better to have professional help and have these teas made for you. So let's take a look at some Indian formulas that are used. Stipulati Churna. Stipulati. This is very famous. If you're anywhere in India and you go into an Indian shop and you say, I have a cough. And he goes, is it a dry cough or a wet cough? And you say dry cough, he's just going to give you Stipulati Churna. So Stipulati Churna is very soothing, and it's got herbs like Vasa or Vasaka that helps. It's a bronchial dilator. There it is, Vasa or Vasaka as I call it. And this is known to be a dilator and helps open up the bronchi and improves breathing. And that Stipulati Churna is very sweet and soothing. So we mix this Stipulati Churna, and we have our product here called Respiratory Tonic, non-productive. There we go. And this is for difficult or painful breathing, dry cough, asthma, and bronchitis. Now, you'd have to add some other herbs with it if you'd had bronchitis, and you could take a coughing tea if the cough was really bad. There's the first ingredient is Stipulati Churna, which is made of 5 herbs, then Tulsi, and there's Vasaka for what I just told you, opens up the bronchi and helps with breathing. Then a little licorice and a little fennel and some guduchi for the immune system, and kantakari, which is also used for a cough. So this is beautiful for a dry cough, but most of this formula is Stipulati Churna, what is traditionally used in India for a long time. And then the next one that is used in India is called Talasadi Churna. So if you go into an Ayurvedic doctor in India and you say, I've got this cough, I've got this breathing problem, he says, there's a lot of mucus and congestion. If you say yes, he's going to give you Talasadi Churna. Talasadi Churna is peppery, hot, spicy. It's more of an expectorant and more decongestion and much more heating than Talasadi. Than Stipulati. And we put it in this formula right here called Respiratory Tonic Productive. See, for congestion, mucus, snoring, colds, asthma, bronchitis, and productive cough. There it is, the first ingredients, Talasadi Churna. Churna means powder, 8 herbs. There's Vasaka again for breathing, Tulsi for the immune and the respiratory. Guduchi is an immune modulator. Kantakari, again, for coughing. So a wonderful formula there for a productive cough. Now, again, somebody's just texted me, how long do I have to take this for? Well, it depends on the severity of your condition. Clients who've had, say, respiratory allergies for 10, 20 years of their lives can end up taking these herbs for 3, 6 months, or maybe even longer, and sometimes needing a little bit during every season. Some people, so we're talking 3, 4, 5, 6 jars of herbs. And herbs, it's a volume game. The more you do, the more action the herb's able to take. See, herbs have actions. You're not treating asthma. You have an action. You're cleaning out the bronchi. You're cleaning out the alveoli. You're getting the congestion out, to the decongestion. You're decongesting the lungs. You could call it almost like a lung detox if you have this type of mucus and congestion. So when you take the herbs for a while and you follow the diet with no mucus, warm, hot, spicy foods, and hot soups, lemon, garlic, ginger, black pepper, and your hot showers, steams, all these things can support it. Then after a few months, the lungs are clear and you can be good for many years. And of course, people have a susceptibility to any condition they've had once. So if I had a patient 5 years ago, 6 years ago, they may took 3 or 4 jars of one of these herbs, followed the diet, maybe had one tea, and it went away. And maybe 4 or 5 years later, they moved to another place, they changed their diet, and then this respiratory condition can come back. So they have to follow the diet and be careful to not have it reoccur. So those are the 2 main categories. Now, again, you could be taking, say, this respiratory, non-productive one for a dry cough with this cough tea, which is very soothing. Those 2 go good together because this is for a soothing type of more dry cough, and this is for dry respiratory. So working fantastic together. Drink the tea all day, have the respiratory tonic 2 or 3 times a day with some honey. You'll notice incredible results in a very short period of time, within weeks, and it's often even the same day. And you can see I have numerous testimonials about how these respiratory conditions have improved for people. For a productive cough, this is my favorite combination, the productive formula with the main star there, the Talisadi Churna, which is used traditionally in India. But if they have a lot of more mucus and congestion, and then we can have them drink the lung tea all day, which is kind of like a detox. Well, this respiratory tonic has more healing properties to it. So those are 2 great combinations I've used for years. Now, if the person has an allergy, like seasonal, then we use an herb here, which called shirish. And shirish is kind of a natural antihistamine. It's made of various herbs, but the main, it's just one herb. It's not a formula; it's just a single herb, and I'll add that to one of these other formulas if it's really seasonal, or I just give them this formula here if we're just talking a seasonal allergy that's not too bad. And we could say modulates the immune system, because you kind of have to kind of calm the immune system down. You don't want it overreacting all the time. And there we go. And detoxifies the lungs. So we can see the first ingredient is shirish. Then we have some other vasaka, kantakari, anantamul, and some cinnamon, a little licorice. Those cinnamon and licorice are supportive. And there's that kantakari again for coughing. Vasaka, the bronchial dilator, used a lot in Ayurveda for breathing problems. So if a person is having more difficulty breathing, I can always take some extra vasaka and put it in with them. And also I have this too, which is called a lung tonic, which is really arishta. Arishta means it's fermented. This is arishta. And we can see the name down here real small. It says right there, vasakadi rishtam. Arishtam. That's vasa, means the herb. Vasaka. Adi means it's got a few other herbs in mixed with it. And arishtam means it's been fermented. So this is easy to take, easy for children, used to improve breathing. It's a natural bronchial dilator and antispasmatic and anti-asthmatic. It's good for cold coughs and bronchial breathing problems. Just wanted to focus in on there. So, usually it's a little combination of a few products together that does the trick. You have to get your mind away from this idea, what do I take for my asthma? Well, I can't tell you. There's different types of asthma. There's different types of, or stages or degrees of bronchitis. So the herbal treatment will always be adjusted to the individual based on their symptoms, how advanced the condition is, and their symptoms. If there's coughing, then we're going to put more herbs to help support the coughing. If there's pain and inflammation, then we're going to put more antimicrobial, antiviral herbs to help fight the infection. So, somebody's asking me, what would you do to build the immune lung system? Well, this is herbs we're talking about right here. Building just general immunity in the body is on another video. But some of these herbs we can see are used in immune building. You can see Tulsi was used in most of these formulas. And in fact, in India, During the cold and the flu season, people have Tulsi growing in front of their house, and they just drink Tulsi tea all day. And this avoids the cold and the flu, because Tulsi is a good immune builder, and also it's good for avoiding respiratory problems. In fact, we have an immune tea right now. We ran out of normal bags. We're selling it so much. And this is to improve immune function, preventing cold and flu, and helps fights minor infections. And you can see the first ingredients is 3 types of Tulsi: Rama Tulsi, Varna Tulsi, and Krishna Tulsi, then backed up by licorice, cinnamon, and ginger. So this is very effective. We recommend people have it with honey, drink it all day. So this tea alone would be very good at building immunity and preventing minor respiratory infection. Now, again, let's just recap here. If you have a dry respiratory condition, then you want to hydrate the body, have more oil and moist foods, no cold foods, and take some of these type of herbs. If you don't have any of these herbs, at least be drinking licorice tea. That would be one of the best simple home remedies you could do for this dry cough. Hydrate the body and have licorice tea. Now, if you had a mucus and congestion, then you'd want to do very hot foods, more spices, more ginger, more black pepper, and more hot foods, even doing some fasting. Cut back on all dairy product altogether if you have mucus or congestion. And absolutely no cold drinks, no cold water, no cold foods. And take, if you were to pick one tea that you would make in the day, it would probably be ginger and black pepper and honey. Drink that all day and not eat. And you'll find within 24, 40 hours, your mucus will clear right up. And you want to really resolve that first. In fact, in treatment, whether you're treating yourself or treating patients, then you also have to think in steps. For somebody's got a dry cough, you want to get rid of the dryness first. You can improve the respiratory function later, but we've got to get rid of the cause, the dryness, this cold, dry quality of Vata creating the condition. That's the underlying cause. This is dry and cold. So that's why we want hot and moist substances. Now, if you have a respiratory congestion and it's been going on for a long time, you're snoring, having trouble breathing, getting clogged up, maybe you have to use oxygen or ventilator or something to help you to breathe better. You want to clear up this congestion first, ASAP. And the fastest way, if you don't have any of these herbs, the herbs are, of course, very quick. And that's why herbs are so much more powerful than just changing your diet. But if you have no herbs, then you can fast, particularly if you're a heavy, overweight person, more of a kapha person, and drink ginger, black pepper, and honey tea all day for 2 days to get rid of this congestion and mucus immediately, and then go back only to hot foods with no dairy. And again, if you have an infection, you want to focus on getting rid of the infection first. Then you could resolve the cough. So it's at least in these 3 stages. First, get rid of the dryness or the mucus or the infection. Second, help the overall respiratory system for 3-4 months taking these herbs. And then even when it's done, there can be a 3rd stage, Rasyana, kind of restorative type of a practice or herb that you could be taking on a regular basis to maintain the health of your respiratory system. So, of course, being an herbalist, we have a lot of tools available to us, which make it much easier and make the results much faster than being on your own. But it can be done on your own. And in fact, many of these teas are available. Similar products are available. Most of these teas and formulas that you saw, these are very traditional Western formulas that other herbalists would prepare. And of course, the Indian herbs that I showed you and formulas are very traditional, and any Indian doctor would recognize these and know their value. But again, they're usually mixed with other herbs. Dosages are important. How much a person takes, how often a person takes, when a person takes, all are the details that are best to have explained to you by an Ayurvedic doctor or practitioner who understands the herbs. And in fact, to treat most people for most conditions, there's always little adjustments and changes that I make to these formulas to make them work just right for the person. In fact, 2 people can come to me and say, oh, me and my husband, we both have asthma. They could even be taking the same inhalers, the same medication. But when it comes to the natural treatment, the herbs can be completely different. Maybe one has dry cough, the other one doesn't have dry cough. The one's getting infection and has pain easy, the other one has no pain. One person's overweight and cold, while the other person is underweight and their body's hot and they feel inflammation and pain and even burning sensations. So the herbs are going to be completely different. The treatment and the approach is going to be completely different, even though they could be taking similar medication. Because in natural treatment, we have to remove the causes, not just, patch it up by taking an inhaler. And these inhalers and medication may be keeping you alive and helping you to continue breathing, but unfortunately, you're not addressing these root causes. So when you address these root causes, which we talked about, should be the real goal of any natural, holistic healthcare practitioner, not just patch you up with some tea that's going to help you with coughing, but actually identify and remove these causes. And that's what we're talking about today. So that's why there has to be some level of diagnosis. Either you have to diagnose yourself, which I helped you try to do just now, or you have to go to somebody who can diagnose you and understand the condition, understand the causes, probably identify some things that you're doing in your life or foods you're eating that are aggravating the condition, and then advise you accordingly how to change your diet, change your lifestyle, and prepare for you a nice herbal formula that can give you relief quickly. So I sincerely hope this helped you. Of course, in this time, it's very important to have good respiratory health and not have dryness, congestion, or infection, or even allergies. Any allergy is a sign of immune imbalance and often has to do with our liver. For most people who have allergies, we often have to treat the liver with some other herbs that we use for treating the liver simultaneously. If you've had a lot of seasonal allergies, generally we're also providing other herbs to help support the liver, because most allergies, have some part of their cause is the poor liver function itself. So once again, I hope that helped you, and feel free to contact me if you need personal assistance in addressing your health issues. And, anybody who mentions this webinar, we give you the discount here. Mentioned below, only $50 for your Skype session. We can do Skype on Zoom, remote calls on Zoom, the phone, or Skype. And all new clients are required to fill out an extensive health questionnaire online first. And it has a whole section just on your respiratory system. So by the time you complete the questionnaire, and I see the questionnaire even before I meet you on Skype or Zoom or talk to you on the phone, I already have your respiratory condition diagnosed just by seeing the choices that you've chosen by completing my form. And in fact, we'll find other systems in the body that often have similar problems. A person who has congestive respiratory can have congestive circulation, could have even high blood pressure and congestion in the arteries. And a person who has dry cough often has dry skin, often dry stools, and dry constipation and digestive problems. So, we just can't treat this underlying causes, whether it's congestion or dryness or depletion, and only think of the respiratory system. We have to think holistically and resolve this for the whole body. So, in fact, not only will your respiratory condition get better, but other conditions in your body will improve, because this is the proper way to address any health condition, is to look at these underlying causes and treat them. And the results are often many things start to improve in your body. So like I said, many times, good health is good immunity. And most people are not truly healthy. We have a kind of a false sense of what is healthy. We believe when we're walking around talking that we're healthy. Well, that's kind of like you're driving the car, but that doesn't mean the engine's in good shape. You have gas, bloating, constipation, poor sleep, weak immunity, just getting infections and the flu easy, then we know you're not healthy. And of course, if you're taking any form of medication then you're not on the healthy category anymore. That's why you're taking the medication. So it's very important to understand what is true health. And true health is good immunity, and all systems, including the respiratory system in your body, are working well. So very important to address that. So once again, thank you very much, ladies and gentlemen, and feel free to contact me if you have more questions. Now I'll stay and answer any of your questions here online. Thank you.